of course, would be in the center of this. Spongy versus compact bone. So again, here's the medullary cavity. That layer right there is compact bone. Spongy bone really appears at the epiphysis, and this kind of hints at sponginess because of the little holes. This shows you, all right, this little display cabinet. They cut the epiphysis. This is the thigh, femur, and if you look closely at that, you can see the little holes in the spongy bone. Okay, so the spongy bone is just full of a bunch of holes, and the holes are filled with sticky redness, which is red marrow. But of course, it's gone now, all right, in these cadaver bones, but that's in the epiphysis. So that takes care of the first part. The sutures, a suture is a dividing line, all right, and we've got some skulls here. You have to be careful of these because there's so many parts here, they tend to fall apart. So you can see them on the plastic skull, all right, and we also have some half skulls down the bottom, but also on this colored skull. I'll show it on this colored skull because I think it'll show up better. But this is the coronal suture, okay? Now, let's talk a little bit about a baby skull. Yes, this is a fetal skull, okay? You can see these sutures better, and they call these things soft spots. Have you heard of a baby soft spot? Okay, if you put your finger on the top of a baby's skull, you can feel the blood coursing through. And basically, you have to protect it because, you know, if the skin was severed, you can go right down into their brain. Eventually, they grow together. So part of this is so that when baby goes through mom's birth canal, she gives natural birth, these skull bones can kind of cross over one another. When the kid is born, his head is like all misshapen because the skull bones cross over and then they flatten out, okay, and then they fuse together, leaving a fusion line, which we call the suture, okay? And so that's where these sutures come from. So this is the coronal suture, okay? This is the sagittal suture, all right? This is the squamous suture. Squamous means flat, okay? And this is the lambdoid suture. Okay? Lambdoid. Yep, and it's, I'm just reading right from the staple packet here. All right, so fontanelles, if you want to write it in on your packet there, fontanelles are soft spots. Okay, fontanelles are soft spots where in the neck. Yeah, if you're following along, there's very little we're going to write on this, but I do encourage people to write a couple of the things that I'm going to tell you. All right, so you've got, this is your anterior fontanelle, okay, the frontal fontanelle. This is the posterior fontanelle. Now this skull was fused together, so this, you know, might have been an infant that was born. Okay, it's real. All right, but this is the posterior occipital fontanelle, the sphenoidal or the anterior lateral. So anterior towards the front, on the sides. Anterior lateral would be right here. Your book shows them separate, okay, which is kind of nice. And then your mastoid is this one back here. All right, but this skull, this real skull, is not showing you anything but really this fontanelle soft spot. But if you look at the picture in your book, which is cited there, 714, it'll make these bones smaller so that you can actually see the membrane and where it is, okay? All right, your head is filled with a bunch of sinuses, okay? And sinuses are holes, all right? And holes are to make it easier, essentially, to lift your head. Oh, come on. One of these has got to have. Anyway, it makes it easier to lift your head and also to resonate. All right. So when you talk, your voice is actually causing resonance. All right. Things are kind of bouncing. We talked about that before. Notice how your voice to yourself sounds different than your voice to somebody else, or the way you hear your voice on a recording. You're like, what is that? That's because those sound waves are coming in through your ear, and this vibration or this resonance is picked up differently. Your own sound of your voice is not just what's coming out and going back into your ear, but it's your face vibrating, okay? And that comes from your skull. But anyway, we have several different areas where we have sinuses, all right? In this frontal region, there is a skull that will show you holes here, and I'll actually have to bring out a skull that, where they call it an exploded skull, where you can actually see holes. But we have holes here. When people go like this, my sinuses hurt, okay? This is where these holes are, in the maxilla and in the frontal region, a couple of other areas, okay? So that's the frontal bone, okay? This is the frontal bone. parietal bone, temporal bones, all right? So they match, let me do the colors. They match the lobes, all right? Frontal bone, remember underneath is the frontal lobe of the brain, all right? Parietal, okay? Temporal, the brown, and occipital, the blue, all right? So those are the bones. All right, if we look at the temporal bone, which is this brown one, you have a lot of markings in this brown bone, all right? And there are a few, this is the marking too. Let me hold it correctly. Oh, it's the other side, thank you. Yeah, this is real, okay? All right, so this is the temporal bone that fits in there, all right? And it has a lot of markings on it. A fossa, you could write this in, is a depression, is a dent, okay? So a fossa is a dent. Your mandible, by the way, your jaw, okay, is basically fits into this like so. All right, so this is your mandibular fossa, okay? The external auditory meatus, a meatus is a hole, okay? So that meatus of a hole is continuous with your external auditory canal, right? All right. A styloid process, a stylus is a point, and that one has broken off, but do you see that little point? All right, they used to call pens styluses, okay? All right, but that is a stylus. The mastoid process is this big projection in the back, and if you put your fingers on the back of your ear, you feel this hard thing right here? That's the mastoid process, all right, back there. That's the mastoid process of the temporal bone. And this brown region is the zygomatic process that fuses with this yellow zygomatic bone, your cheekbone, okay? So the zygomatic process comes from the back here, okay? And then the zygomatic bone is actually a separate bone, but they fuse together, okay? So that's your temporal bone. All those markings are in the book, so don't think you've got to know it just from the video, because it's all in the book, and the book is really clear. All right, Malleus and stapes, we already know that. Here's the, oh, the stapes is gone. Oh, I have to find that. Oh, here, we've got a different one, Malleus and stapes. Okay, they made them very big, okay? The occipital condyles. The word condyle means knuckle, okay? So this word gets used over and over again, and whoever came up with that, whoever was sitting around the table saying, hey, let's call this one knuckle-like, hey, let's call this one knuckle-like, kind of used a little too much. But here's the occipital bone. We're looking at the bottom. This is where the spinal cord goes up, all right? The word foramen means hole, big hole. So this is foramen magnum, all right, big hole. And these little bumps, okay, are the occipital condyles, all right, on either side. The occipital condyles are bumps, all right, and your book shows that. Okay, in the skull, we turn it this way, here's the face, we turn it this way, you can see a butterfly or a bat-shaped bone. That's called the sphenoid bone. On a test, it usually is separate, okay? So it fits, right, how does it fit? Into the skull like this, okay? So that's the sphenoid bone. You have greater wings and lesser wings. Let me see if we have a plastic version, because the plastic version tends not to lose its parts, okay? All right, greater wings and lesser wings, all right? The sella turcica, you might want to write that in, actually literally means Turkish saddle, okay? Like somebody thought, hey, it looks like a horse saddle that somebody would sit in. You see how it's kind of an indentation, all right? And that's basically what protects your little pituitary gland. So remember, the pituitary gland hangs down and it looks like, oh, it's just gonna wobble all over the place like one of those punching bags, but it keeps it somewhat protected because there's a wall over here and a wall over here, all right? That's the sella turcica, the Turkish saddle, okay? And the sphenoid also has holes in it. So that's where we get one of the four sinuses. So we've got holes in the maxilla, we've got holes in the frontal, we have holes in the sphenoid bone, and that is one of the four sinuses we have, okay? The ethmoid bone, let me hold the skull this way. Hopefully you can see it. I'll hold up a few. Actually, this one is not very clear, but right up front, there's this little ridge, and that's called the crista galli, which stands for coxcomb. You know that little red wiggly thing that you have on the male chicken, the cock? Okay, that's what they call it. It's circled there, all right? That's part of the ethmoid bone. On either side of it, you have little holes, and those are the cribriform plate, like a flat plate, with little olfactory foramina. That's where those optic nerves come through. If we take a separate bone right here, that's the ethmoid. That fits in right there, okay? Fits in right here, okay, on the skull, okay? So there is the crista galli on either side of the crista galli. So the crista galli pokes up. On either side is a plate. It's flat, and the flat plate is called the cribriform plate, and it's filled with olfactory foramina, little holes. A foramina is a big hole, foramina, little holes, okay? All right. Then you have also concha, which are extensions. You've got superior and middle concha, and then a perpendicular plate that's in the middle. So in the middle is a perpendicular plate that goes down, and in the nose, if you can see inside of the nose, the dividing bone is the perpendicular plate coming down from the ethmoid bone that meets up with the vomer bone that comes from the bottom. So that septum, or that cross wall in the middle of your nose, is not one bone, it's actually two bones that came together and fused. The one from the bottom up is the vomer, all right, and the one from the top down is the perpendicular plate of the ethmoid bone.
Is that how people end up with deviated?
Yeah, deviated septum. Yep. Yeah, it could be because of the way they didn't fuse correctly. Okay, in part. All right, so anyway, let me hold this correctly. All right, so coxcomb, then the ethmoid is our fourth area of sinuses. There are holes in it. So you see ethmoidal sinuses, those are holes. You might want to write that down on your sheet, okay? I'm going to back up. If you're writing, go back to where it says occipital bone, and you'll see it says 7.8. Put in 7.6 as well, okay? Because occipital condyles are pointed out on 7.6. All right, under ethmoid bone, the ethmoidal sinuses are holes, okay?
7.6 in there, I'm sorry.
Next to occipital bone at the towards the top of the page, okay? All right, so we've got superior nasal concha, middle nasal concha, all right? And let me just explain this to you. So we've seen pictures, we had a model before, but do you remember today we looked at the side of the nose, okay, and we were looking at the olfactory? The inside of your nose is not two round cylinders, it's actually bumpy. And the bumpiness inside of your nose is covered with mucous membrane, okay? Now, I don't want you to all stick your fingers up your nose, but if you did, it's not perfectly smooth on the inside. It's got these bumps, and they're covered with mucous membrane. The very top bump, really high up in the nose, is the superior nasal concha. Then below it, you have the middle nasal concha, all right? And you can see it here, superior and middle, and then that line down the center is the perpendicular plate. What it does is it creates a wavy turbinate so that when you inhale dust and particles, they're more likely to hit membrane. Now think about the opposite. If your nose was just two straws, cylinder, and then it connected to the back, when you inhaled, everything would go straight down into your lungs, and that would be a big bad thing, right? Because you're inhaling bug parts and skin and dust, and everything would get all clogged up and you'd suffocate. So what happens is when you inhale, it hits one of these membranes so that the junk sticks to the membrane, but the air goes past. So you're getting almost pure oxygen. And what do we call that junk? We call it snot, boogers, dry mucus, whatever. All right, that's what you blow out of your nose, or some people, not delicately pick out of their nose. All right, but you're getting rid of dry mucus that's trapped all that junk. Okay, so I know you've never thought about that before, but that's essentially what snot or boogers are. All bug parts, lint, spare skin, and dried mucus, okay, that you're pulling out of your nose or whatever. Okay, so now separate is the inferior nasal concha. It is not part of the ethmoid bone. So they're like wings, superior, middle, and then the inferior nasal concha are these two projections at the bottom inside the nose that aren't even part of the ethmoid bone. They're separate. So notice it says, where does it say? Inferior nasal concha, further down on your list, totally separate bone. Okay, two separate bones on the other side, but the function is the same. So it creates this wavy membrane that helps to stop the air and trap junk that we inhale. Okay, all right. Nasal bones. What I want you to remember, let me do this with the skull here. Okay. Nasal bones right on the nose there, they're the white, okay, nasal. This brown is maxilla, all right, and that red is lacrimal. Remember tears to lacrimate? So try to remember the alphabet, L-M-N, all all right, LMN. The red is L, lacrimal, the brown is M, maxilla, all right, and the N, the nasal bones, all right. Where are we? Nasal bones, maxilla. Okay, so maxilla over, he's lost his lower jaw. We'll give him a jaw in better condition, all right? Jaw replacement, essentially. They don't belong together. But we can think mouth, all right, jaw, maxilla, mandible, A over B, maxilla over mandible. Mandible's the lower jaw, all right? So in the maxilla, the alveoli, another thing to write in, these are holes, okay? And it is not clear in your book. So I'm going to show you this picture of this person's broken jaw. Really bad surgery here with the tape. But the hole that your tooth sits in is called an alveolus. Many holes are called alveoli. And in the book, the arrow just points to that area and you think, well, what is it pointing to? Bone, teeth? Because they're not even showing you the hole because they haven't removed the tooth. So the alveoli, and write it in, under maxilla, is the hole where the tooth sits, okay? A foramen also is a hole, all right? A foramen is a hole. So the incisive foramen, turn this over, let me show you. Say, okay, good. The maxilla is brown, all right, or kind of brownish purple. The incisive foramen is a hole that's right here, okay? And in this skull, you can see it, incisive foramen, okay? All right, what is it for? I don't know, all right? But it is a hole, but sometimes they put, anesthetizing chemicals there, all right? That's the incisive foramen. All right, actually, all holes have things poking out, nerves usually, okay? Nerves, blood vessels, but that's the function of any dent or any hole. All right, this is a palatine process. Your palate, your hard palate up front is actually part of the maxillary bone. So that's the palatine process. This red, all right, horizontal. Yeah, the brown is the palatine process, which is actually part of the maxilla, all right? The palatine bones are also called the horizontal plates, are the red ones. So that's often a confusing thing because this process, the word process means a projection, something that pokes out. So we've got a lot of words that mean dents and holes, and then we've got words that mean things that poke out. Condyle, process, those are words that mean it comes out. So that's the palatine process, the incisive foramen, okay? Your maxilla also has holes in it, but none of these bones are going to show you that, so that's our fourth sinus. So remember we said there are 4 bones here that have big gaping holes in it to make your skull lighter, okay? Because if they were all filled in with cement, we couldn't hold our heads up, all right? And it also causes resonance, all right? It vibrates and creates sound, all right? So we talked about maxilla, sphenoid, ethmoid, and the frontal bone. They all have sinuses, and they can become filled with fluid when we're sick. All right, so we talked about everything under maxilla. Zygomatic bones, yellow, cheekbone, okay? Lacrimal bones, we talked about it, red, LMN, lacrimal, tears, right where your eyes are. A fossa is a dent, okay? So a fossa is a dent. And again, dents usually harbor blood vessels or nerves or something that pokes out. We already did the palatine bones, but that was red, also called the horizontal plates. The inferior nasal concha are the bottom bumps, okay, the bottom projections inside the nose. So you've got vomer from the bottom, inferior nasal concha on both sides. Okay, vomer we just did. Mandible, lower jaw, okay? So, and this is pictured in your book, all right? The pictures are good. Oh, okay, I forgot to give you another page number. Let me go back. All right, I wrote it in red. Go back to maxilla. Under maxillary sinus, write 7.9E, okay? Under maxillary sinus, 7.9E. Okay, so we're down the bottom, all right? This is a condylar process, and again, they're using that word that means knuckle, condylar process. This is the coronoid process. A process is an extension, a bump, comes out, all right? Condylar, more like a knuckle, all right? Coronoid. An alveolus, remember, is the hole where the teeth are, but this guy has a full set of teeth, but the hole that it sits in is the alveolus, okay? Alveoli is many, all right? And the mental foramen is right there, okay? Mental foramen, all right? That's a hole there, all right? That's page 2. All right, hyoid bone. Hyoid bone is the only bone that does not articulate with another bone. It's right here. Okay, that's the hyoid bone in the neck region. All right, so it doesn't actually articulate with another bone. That's why you'll see that it has wires here. All right, so you've got greater wings and lesser wings, hyoid bone. All right, I tend not to ask that one separate. All right, your backbone, I guess we can work with it here. Okay. Your vertebral column, you have 7 cervical vertebrae, all right? And if you touch at the base of your neck, the biggest bony one is number 7, okay? It's the last one, that projection that's kind of at the top of your shoulders there, all right, vertebral prominence. All right, you've got 12 thoracic vertebrae, all right? You have 5 lumbar vertebrae, and the difference between these, okay, when you look at them separate, all right, and we should do that.
Here, what chapter is it? 13?
Some.
13.
All right, we have some of them are plastic, but your lumbar vertebrae have this process that comes out the back called the spinous process, and these are flat and they come straight out, and I'll try to get some separate vertebrae so you can see them, but the body of it, which is this section, okay, is big, all right, and I don't think I have any on there. I'll have to go back and grab a few.
What do you call that?
Spinous process, okay, so I'm going down the list here. Sacrum, you actually, the tail end here has fused vertebrae, so they're not separate. So this is the sacrum, sometimes referred to as the sacral table because it's flat and you can actually feel its flatness there. So it's one bone, but they're fused vertebrae. This is referred to as the auricular surface. Okay, did I put this in somewhere?
No. Yeah, you did.
Oh, it's down further. Okay, I see, so it's separate. So notice if we go down towards the bottom, all right, it says sacrum auricular surface, the word auricle, ear. So aura means auricle, auditory. Somebody said, hey, especially on this side, that looks like an ear. So they call that the auricular surface, sacrum auricular surface, okay? All right, coccyx, the tailbone, all right down here, 4 fused vertebrae, all right, although they say 1 bone.
Oh no.
All right, intervertebral discs are blue, okay, and they're made of cartilage, all right? Remember, that's the fibrous cartilage that gives some support, but it absorbs some shock and allows the bones to kind of move past each other, all right? Intervertebral foramen, if we look at this, all right, this is the occipital bone, the back of the skull, and these are the cervical vertebrae. There's that pointy one, okay? The intervertebral foramen are between the vertebrae, and that's where the spinal nerves come out, okay? So that's the hole there. The actual hole itself, vertebral foramen, right here, that's the spinal cord, all right? So that hole goes all the way down each of the vertebrae, vertebral foramen, okay? So if we look at one vertebra, the fat portion is called the body, all right? We talked about the vertebral foramen. This is the spinous process, the one in back. You can feel all the spinous process with your fingertips. Those are those things that come out the back. And the ones that are on the side, the transverse processes, okay? Side to transverse processes on either side, okay? All right, the very top, and I have these bones as being separate, but you can look at it here. The very first one is the atlas, the second one is the axis. So C1 and C2, all right? Notice it says atlas, all right? You've got the front arch and the back arch, the anterior arch and the posterior arch, but honestly, I don't waste a lot of questions on that, okay? The axis itself is the second one. C2 is called the axis, and it has a little, it's hard to see. You're gonna have to see it yourself, but also in your book. It has a little horn come up. Do you ever see a saddle or sit in a saddle on a horse? You know that metal horn that comes up that you can hold on to? Okay? That's called the dens, and it actually fits inside of the first cervical vertebra, the atlas, so that you can shake your head no. All right? So it's rotating like this, okay? Going around and around and around. All right? So that little horn piece that comes up is called the dens. And the word bifid, if you want to write this in, okay, means forked. All right, they refer to the tongue of a snake as bifid. There's two little things that come out. Its tongue doesn't look like ours. fork.
And upload on
So
YouTube.
I don't know if you can see it, but the spinous process up here breaks into two projections, where in this region all the way down it's one, but it's forked here like a forked tongue. All right, so you have a bifid process for the second vertebra, but also the other ones. All right, so we talked about that. The sternum, okay, the breastbone, the sternum here, there are three parts to it. This section is called the manubrium, and it actually looks like the letter M. M, right there, manubrium. This is the body, and this little point is the xiphoid process. Starts off as cartilage, but eventually turns to bone, okay? And then you've got your ribs, all right? There are 12 sets of ribs, all right? The first 7 are called true ribs. This is not a rib, by the way. This is the clavicle. You can feel it up here. That's the clavicle. That's not a rib. That's the first rib. 2, 3, 4, 5, 6, 7, okay? Those are the true ribs because they connect from bone. This is supposed to be hyaline cartilage to the sternum, okay? 8, 9, and 10 are what they call false, 8 through 12 rather, are false ribs, but 8, 9, and 10 connect cartilage to more cartilage before it connects to the sternum, all right? So that's why they're called false ribs, all right? And then these are called the floating ribs because they don't even connect, okay? Floating ribs, 11 and 12, okay? All right, intercostal space means between the costa. These ribs are also called costa, so that's intercostal space. Okay. All right, and that will get us through the first bit of information. We're breaking this into like 3 or 4 different chunks, okay? So I know it's a lot, and I know we have a lot of time, but what might be good is to just turn to the page, pick up the bone, point it, say it out loud, teach a couple of people in your small group, go on to the next thing.